Hi, everybody, and welcome to our webinar on POTS. I am excited today to welcome 3 clinical psychologists, our guest speakers, all from Evolvinn Therapy and Counseling, and they're going to talk today about 6 mental health hacks for navigating life with POTS. During the talk, the 3 of them are going to take turns presenting these hacks. You are welcome to enter your questions into the Q&A, and we'll address those at the end of the talk. So welcome, everyone, and I want to introduce Dr. Lori Dos Santos, Dr. Demi Maglio, and Dr. Caitlin Patton. So Lori, you're going to kick us off?
Yes, thank you so much for having us, Dr. Lewis. We're really excited here today to talk more about POTS and to talk through some life hacks that are really helpful and effective for managing an invisible chronic illness. So before I jump in, I just want to share that Evolvinn Therapy is a virtual practice, a mental health practice that specializes in working with chronic health conditions. So each of our areas of expertise are a little bit different, but the common thread between us is really the passion that we have for working with patients with chronic illness and the evidence-based practices that we use in order to support our clients. And so we provide individual support, we provide caregiver and family support, and also group support. We have several POTS groups and several other groups that are forming. And so as we started to kind of brainstorm for this webinar together, we actually came up with many more than 6 life hacks. And I want to mention that just because it starts us off in a place of hope, that there are a lot of skills and strategies and tools to manage some of the challenges that come along with having POTS, some of the ups and downs of the condition and the inconsistencies and some of the triggers and challenges. So we could probably spend hours and hours talking about all the different life hacks out there, but we're really going to kind of hone in on strategies related to CBT, cognitive behavioral therapy, ACT, which stands for acceptance and commitment therapy, as well as DBT, which stands for dialectical behavior therapy. So I'm going to jump into 2 life hacks that really come from DBT, dialectical behavior therapy. And so DBT is an evidence-based therapy approach that really focuses on skill building and skills to improve the quality of our life. So it touches on emotion regulation and distress tolerance and how to make our interpersonal relationships stronger and develop coping strategies and mindfulness strategies across the board. And so we all find all 3 of these modalities really helpful and effective in working with patients with chronic health conditions. So the first strategy I'm going to talk through is what's called cope ahead. And that is one of our emotion regulation strategies. And it really helps us to prepare for life events in advance. So if we think about being proactive rather than reactive, cope ahead really helps us to plan for difficult situations, triggers, challenging moments, across the board. And so it really puts a lot of thought and a lot of intentionality into how do you plan for the ups and the downs and the roller coaster ride of having an invisible chronic illness. And it really comes from 4 main steps that come with it. So the first step is really to think about identifying potentially challenging situations that may trigger intense emotions, symptoms, heat sensitivity, and really being pretty specific about what those situations are. Thinking about your week coming up, your month coming up, something that you're feeling nervous or worried about, or maybe there's an urge to avoid something in your life. And really kind of thinking about what those situations are for you in your life. So some of the ones that come up often with clients who have POTS are things like traveling, navigating an airport, managing a shower, which tends to be one of the really dreaded and challenging parts of everyone's day or week, managing a long car ride that you're anticipating, going to a holiday dinner where maybe you haven't seen family in a while and there's going to be questions that come up around your chronic health condition or the job that you're no longer able to work at, taking an exam at school, going to see a new doctor. Those are probably some of the more common ones that tend to come up, but you really kind of take any situation that you're thinking about or anticipating or having some anxiety around to really kind of plan in advance for it. The second step really is trying to figure out what coping strategies you want to use, what you want to implement. So, if you have some background with therapy, thinking about, some skills, some strategies, concepts like pacing, really kind of exploring, okay, what would be my worst case scenario here? And how would I manage it? How would I answer that really difficult question? How would I think through what kind of that nightmare of a traffic situation might look like and how I would manage that car ride? What would be some of the logistical considerations? So do I want to think about reserving a wheelchair at the airport to get through that really dreaded security line? Do I want to think about how to take breaks when I go to a grandparent's house for dinner? Is there a room in the house that I could kind of escape to take some breaks or to lie down in that situation? You want to kind of think through both the emotional side of things, so what emotions might come up for you, but also the logistics of things, how to take breaks, where to take breaks, what strategies are going to be effective for you in those moments. One of the most important parts of this process is to be able to visualize the situation in your mind before you enter the situation. So we want to be as vivid as possible in thinking about, imagining, visualizing the experience, your thoughts, your feelings, your behaviors that you might anticipate. We don't want to watch the situation like you're watching a movie. You want to actually imagine yourself in the situation directly. Not thinking about the past or the future, but what the present tense might look like. We want to get a really solid, active, vivid picture of what that's going to look like for you internally. And then the fourth step, which we want to focus on too, is rehearsing this. So not just thinking about it once, but thinking about it over and over and over again until you're almost tired of thinking about it. But really kind of anticipating what the situation is going to look like, what might arise for you in that situation, how you're going to cope with challenges that arise, what you're going to say to that family member when they ask you questions about what's happening in your life, or how you were okay to go on a trip a month ago, but weren't okay to, meet them for dinner last week. Thinking through how you're going to answer those questions, how you're going to cope with the challenges that arise, the problems that may come up. And you want to just practice this repeatedly in your mind and visualize how you're going to cope ahead in these situations. You also want to have a lot of self-compassion. It's not always going to look as pretty as it does in your mind ahead of time. So just being kind with yourself, being able to be compassionate with yourself, forgiving yourself if things don't go exactly as planned, and using that to help inform the process the next time around. And so this cope ahead strategy really helps you to feel more in control of your emotions, of your symptoms, of your behaviors, by anticipating the potential challenges that arise, developing a plan to cope. You can feel more confident going into a situation. And by feeling more confident, hopefully you can also feel less anxious about entering that situation, managing your emotions and symptoms more effectively. So there's a lot of great examples and things that you can dive into to kind of individualize and customize that approach, but really kind of want to hit home on the concept of thinking ahead, planning, anticipating, pacing yourself around the things that are really challenging, thinking about what the breaks may look like and what the coping strategies may look like, and just kind of rehearsing that in your mind repeatedly before you go into some of these more challenging situations. The second strategy that I want to jump into is also a DBT strategy, and it focuses on self-validation. And so unfortunately, one of the biggest challenges I find in so many individuals who have invisible chronic health conditions is the extensive amount of invalidation that occurs by many different people in their life, whether it be doctors, teachers, family members, partners, the gaslighting, the dismissiveness, the not believing the symptoms that happens, the trauma that's associated with not being believed for so many years, often on the journey to get a diagnosis, just becomes so significant. And that's honestly one of the things that drew me to do this work, is to be a person who can try to understand, who can try to validate. And oftentimes the beginning stages of therapy work is just being in that validation and understanding chapter because there's so little of it in many people's lives. And so thinking about when people can't understand us, what we're going through, they tend to reject those things. And so it doesn't mean that our experiences aren't valid, and it doesn't mean that our thoughts and feelings aren't real. But people who either don't have the time or don't make sense of what's going on for us end up kind of pushing that away. And it causes a significant amount of turmoil for people's lives. So we want to kind of focus in on validation. And so the idea of validation really communicates that you can understand. Usually we use it externally sometimes, and just understanding what another person is feeling, what they're going through, what their thoughts and actions make sense, and are understandable to you. And it often shows in conversation that we're listening, that we have empathy, that we can really be understanding of another person, that we're being non-judgmental about their feelings, their emotions, their behaviors, decisions, whatever it might be. So when we think about self-validation, we actually want to think about perceiving our own feelings and thoughts and behaviors as real, and that they make sense, and that they're accurate, and that they're our experience and they're acceptable. And how do we really embrace our own experiences in a non-judgmental way? Throw the judgment out the window. Anything that doctors or teachers have shared with you in the past, we want to really try to lower that volume inside of us and increase our own volume to be able to provide that self-validation for ourselves. And it becomes such a critical part of this process because there's so much external invalidation that happens. And so thinking about, like, how do I even start that process? How do I go about validating myself? And the first step really is just to be an active listener to yourself, just as you would to a friend or family member, paying attention to yourself, being mindful of your thoughts, your feelings, your behaviors without judgment. Like, just what are the facts? What are you experiencing here? And then we want to think about describing those feelings, those emotions, those symptoms without any judgment. What are you experiencing? What is that symptom that you're having? What is that emotion you're feeling? And letting ourselves know that it makes sense. It's okay. I'm having this thought right now, and it makes sense. Anyone in my shoes would feel this way as well. You want to respond in a way that shows that you take yourself seriously and that it's okay to have these emotions. You want to be able to acknowledge the emotions, the symptoms, the behaviors, that they make sense in this situation without judgment, standing up for yourself, being your own advocate, being able to be your own cheerleader, and really believing the things that you are experiencing, the things that you're saying, and having self-respect for yourself. And this is something that often comes up in the POTS support groups that I run is, group members are able to provide that for each other. So when people are doubting themselves, am I really this sick? Are my symptoms really that bad? Group members are able to provide that external validation, but also say the words that we use towards ourselves, we would never use towards other people. So can we think about how we might validate a friend or family member going through something similar and start to use those same words with ourselves? And so some ways to kind of think about validating yourself day to day is having daily check-ins with yourself, setting aside time each day to pay attention to your thoughts, your emotions, your feelings, your bodily sensations, what you're feeling internally without judgment. And just being able to observe what that's like for you, what you're experiencing, and really catch yourself when you're being more critical or judgmental of what you're feeling. Journaling can also be really helpful in thinking about kind of expressing your thoughts and feelings, exploring how your past influences your present, and acknowledging that your feelings, your symptoms are all valid. Providing yourself with positive affirmations, so validating statements, being your own cheerleader in your day-to-day routine, reminding yourself of your worthiness, your strengths, your capacity for growth, and just being able to, really support the experiences that you're having. and also just having self-compassion, being able to provide yourself love and kindness and some TLC in the way that you would for someone that you really cared for as well. And so this can have a lot of benefits in our life. It can really enhance our self-awareness, paying attention to what's happening for us internally, improving your self-confidence, your self-esteem, and handling difficult situations that arise, managing emotion regulation, and just decreasing anxiety or kind of self-doubts, and enhancing your sense of resiliency as well. So again, these are just kind of quick summaries of what some of these skills are. There's so much more. We could have more than an hour on each of these skills, but just to kind of think about the highlights of them and how they really can be effective in managing chronic illness.
I do want to add something to that if I could.
Yeah.
It's so, I love what you said about how when people don't understand something, they tend to disregard it. And I, as a medical doctor, and I know so many of our patients see multiple medical doctors and have experienced that sense that their feelings aren't real or aren't valid. And because so many of us, we don't really understand POTS as much as we would like to. And so the instinct we have as doctors is, it's not real because we don't know what it is. There's no test to prove it. And so as a result, I think so many patients have been to so many doctors who've told them, they have anxiety, they have depression, which they may have in addition, but I agree, it just makes it so much worse. And so to get your validation from yourself internally, rather than relying especially on the medical community, but even, your parents, your friends, your teachers, who will make you feel like it's not real because they don't understand it. So, having been guilty of that, I just want to just highlight that statement so much for everybody. You can't rely on other people because everyone has their ego, they have their own baggage, and so they may sort of take it out on you if they don't understand it. That's really well said.
Yeah, thank you for supporting that and emphasizing that. That's really helpful.
Thank you. All right, are we moving on to Dr. Maglio? Is that?
Yes.
Okay, great. I think you're muted. Sorry, there you go.
Absolutely. Yeah, thank you so much, Dr. DeSantis and Dr. Lewis. Those are such excellent points. And I think what you'll find throughout this webinar is that a lot of these skills tend to build off one another and can kind of weave into other ones. So the two skills that I'm going to be covering they come from acceptance and commitment therapy. So control the controllables and observing self. Before we go into that a little bit, I'll give a little bit of an overview of what acceptance and commitment therapy is. It really is about accepting all of our emotional experiences, whether they're positive, negative, helpful, unhelpful, just really accepting them in a non-judgmental way, and helping you live a life that's guided by your values so that you can still live a meaningful life despite managing POTS and the symptoms that come with it and how it impacts your life. So it really enables you to relate your experience of life, yourself, and others with a lot of flexibility that's guided by what's important to you, and that's by your values. So it helps you reach this level of self-acceptance where you can then shift your focus from things that are outside of your control to things that are within your control. Because like we know, living with POTS can be incredibly overwhelming, especially with the unpredictability of how you might feel one day in comparison to the next day. And I know too, as we're heading into the warmer weather, that unpredictability can tend to be a lot more maximized. And of course, it's natural and human to get stuck on the parts of living with POTS that are outside of our control. So knowing, like, let's say, I think where I live, it maxed at over 100 degrees the other day. So even just getting stuck on, oh, it's really hot outside. Or if you're in a type of work or a type of school setting or type of activity that requires that you're on your feet a lot more. It's easy to get stuck on those things that are in our environment, or maybe things that we need to do for other people that might be outside of our control. And sometimes that can lead to this sense of feeling powerless And one really powerful way to regain that sense of control is by shifting your perspective and focusing on the elements of your current situation and your day to day that are within your control and things that you can manage. So, there's a couple of practical tips that can help you shift your focus onto things that you can control. Because I also recognize that it's not always easy to do that, right? When there's so many things that are outside of our control. But one thing that can be really helpful to shift your focus on is by practicing some mindfulness. Dr. Dos Santos mentioned this a little bit before. Paying attention to the present moment without judgment. So when you're feeling really overwhelmed, it can be helpful to focus on the here and now rather than worrying about what may or may not happen in the future or worrying about things that are outside of our control. Um, and one of the ways that we can do this is by setting some achievable goals throughout the day. So, setting small, achievable goals that are within your control can help you build momentum and make you feel more like you're in the driver's seat of your own life. So, this might involve breaking down some larger tasks into smaller steps that you feel like you can manage. And I also think the bigger piece of this, too, is showing yourself some self compassion on those more challenging days, especially if you feel like initial goals that you set need to be adapted or adjusted to meet you where you're at on a given day. So if you're having a more challenging day and you need to adjust the goal that you set for yourself the day before, that's okay because we're also going to have challenging days and we're also going to have days that are better. So it is okay to adjust those goals. We just want to make sure that they're realistic to meet you where you're at in the present moment. Another strategy that can be really helpful too to allow you to focus on the things that are in your control is something Dr. Dos Santos mentioned before. So I won't get too much into it, but it's this idea of prioritizing self care and a coping ahead toolkit. So focusing on things, if you know the weather is going to be warmer, for example, staying hydrated by carrying a water bottle with you, maybe putting ice in it, carrying a fan, or if you have to go in the car. Um, Maybe finding ways of parking in the shade if possible, really trying to be proactive and knowing some of the things that are going to help set you up for success during the day. And doing these things too by focusing on engaging in regular exercise and hobbies and things that you enjoy can help you feel more grounded and centered, especially when there's so much else going on that might be outside of your control. Um, and then two, cultivating an optimistic mindset and focusing on the positive aspects of the situations. So maybe at the end of the day, reflecting on something that was difficult and thinking, okay, what went well here? What am I proud of myself for that I did today? Rather than dwelling on the negative or things that could have done differently. And sometimes too, controlling the controllables also involves advocating for yourself too when needed. Because I know that there can sometimes be this feeling of not feeling totally understood by others. So if there are certain things that would be helpful, whether it be in a school or a work environment, or maybe when you're out with friends, really feeling like you have the confidence to advocate for the things that you need. Um, and that can help you feel a little bit more grounded too. Um, Another skill that can be really helpful too is observing self, which is an interesting concept, but really involves taking some time to reflect on who you are, the type of person you want to be, and what truly matters to you. So it's kind of like your why. And this process can involve really identifying your values. So, what are the things that matter to you? For some people, it might be family, friends, health, maybe pets, or maybe they enjoy playing a sport or running, whatever it might be. What defines you as a person? And then the second piece of that is examining your thoughts, feelings, your behaviors, the action oriented things that you do during the day and seeing how well they align with your values and your why. And one really helpful tool that I like to start figuring out, okay, how am I aligning well with my values? Am I living a life that aligns with the things that matter to me? Is what I like to call like a values pie chart. So, you think you have a full pie, right? And there's however many pieces in it. If you were to define, 4, 5, or even 8, however many values really matter to you, you'll want to draw a pie and give each of your values a piece of that pie. And you'll want to spend some time looking at it, right? And seeing how much of the pie really belongs to each value in your present day. And then this can help us decide whether our values are taking up too little or too much of the pie. Because oftentimes with POTS, we might feel like our world and our identity revolves around our chronic health condition and some of the limitations that we have, or some of the extra things that we need to do that we didn't previously have to think of. So for a lot of people that I work with, that when we do the values pie chart exercise, come to realize that perhaps the piece of the pie that is dedicated to their chronic health condition is overwhelming other pieces of the pie. So part of it is thinking about, okay, how can we still have POTS be a part of our identity, but not take away from the other things that matter to us? So then from there, we think about, okay, well, let's create a new pie and create our ideal slices, right? So thinking about all of your values again, and thinking about, okay, how much time do I want to dedicate to each thing? And then from there, you can start to figure out, okay, well, what can I do to act more in line with my values? How can I reconnect with family? Let's say if that's been lacking because maybe you're withdrawing, right, from certain family or friends. How can you be more engaged with them? And even just by taking the time to observe these things and observe the differences in how much time you're dedicating to each of your values versus how much time you really want to be, you can discover new things about yourself. You can reconnect with your values in a new and exciting way. And you can identify strategies that allow you to live a meaningful life that's guided by your values, despite and while living with a chronic health condition. So it also offers this opportunity to be a little bit more creative. Because even if you do feel like you're limited in some sort of way because of your physical symptoms, you still can act in alignment with your values. It just might look a little different, and that's okay. So there's a lot of different ways that we can go about it in terms of, being really creative and finding new ways to align with your values. But sometimes by just noticing the differences from where you're at currently and where you want to be can help you develop a road plan from there.
That's great. I think so many of us just work on getting from point A to point B and then to point C and don't stop and reflect. But that the value of reflecting, even though sometimes it's kind of a painful exercise, I bet to look at that in the eye and say, maybe this isn't where I wish I were, and it's going to be perhaps some hard work to get this pie to look more like I want it to look. But forcing yourself to do it, and especially with the support of somebody like you, I think would be a really helpful exercise. Thank you.
Absolutely.
Okay.
And then I'll pass it on to Dr. Patton.
Yes, so I will be finishing off with the last two skills. So, as Dr. Maglio just said, and we've kind of all been hinting at too, so much of this is interwoven. There's the practical pieces. There, just like you just said, Dr. Lewis, too. There's the painful pieces. There's the enlivening pieces of this, and that's our lives. Our lives are complex, and then with an invisible chronic illness or invisible health challenges, it adds a whole other complexity to life that we have to navigate both on our own, but also with others. So hopefully today, if there's a skill that hits someone and that skill really seems pertinent, that would be great. But these are all parts of a toolkit that we might need at different times, different seasons, different symptoms, different emotions that are coming up. So the two that I'm going to be focusing on, I kind of think of them almost like a camera lens. They're two skills that in their own way really work on perspective. Perspective shifting. So the first one is kind of widening your aperture. being able to see where you are now, it's not where you will always be. That's called ride the wave. And the second one is going to be catch it, check it, change it. And that's actually zooming in and analyzing and looking at our thoughts in high detail. So the first one is ride the wave, and I just think this is a fantastic skill. I'm more of a visual person, so any metaphor or image that I can have in my mind is often very helpful for me. And ride the wave comes from dialectical behavior therapy, kind of popularized it. And the whole point of it is to be able to regulate our experience and our emotions, to be able to handle the distress or the difficult, strong emotional experiences and physical sensations that can come up in our lives. So specifically with POTS, one of the things I like to acknowledge too is that those physical sensations so directly impact our emotional experience and our thoughts. And to be able to tease them apart is part of the journey, but sometimes to just acknowledge that they're so closely tied is also really helpful too. And our autonomic nervous system, right? When we think about dysautonomia, so often it gets mislabeled as panic or anxiety when it's truly POTS because there can be so much overlap with those. So ride the wave, I think, is just a really powerful metaphor. If you want to close your eyes or kind of just think about being in an ocean, feeling those waves coming at you. I grew up in Southern California, so it's something that feels pertinent to me. And I remember looking up and seeing this big wave coming and just feeling like, oh no, how am I going to swim through this? And oftentimes those intense emotional experiences, physical sensations, or distress that we feel in life can feel like an overwhelming wave, like a tsunami, almost something that is relentless. And so when we're learning how to ride the wave, we can't stop the waves. We can't make them, diminish even. We don't even have control over how big the waves can be. But what we can do is learn skills and coping techniques that can help us navigate the surf itself. So oftentimes when we're having one of those strong experiences, it can almost feel like it's intolerable. One of the things I hear often from patients is, I don't know when the next wave is going to hit, when's next flare or symptom that's going to hit. Specifically with POTS too, I don't know if I can handle what this looks like. I just don't have a sense of what's coming next. And that can feel so distressing and just fatiguing. So when we have those strong sensations and emotions, oftentimes what we'll try to do is respond to them. Some ways I see patients trying to respond to them that might be less effective. So like Dr. Maglio just was saying, oftentimes we want to understand that there are, we can cope ahead. We can understand why certain things would make sense in that moment. And we also have some choices in how we want to respond to them. So some of the things I hear oftentimes when we're trying to ride that wave is, first of all, just knowing that it's a wave. Much like a wave will kind of grow and crest and then crash, it doesn't last forever. So those emotions and sensations that we're feeling will ebb and rise and then release. Even negative emotions do not last at the same place that they are always at. Similarly, positive emotions, when we feel them, that's not the last time that we are likely to feel them. Life is full of these changing tides that we can learn to respond to. And what we want to do is learn to respond to them effectively and in a way that helps our health overall and is in line with our values. So for some people that I work with, when they see a wave coming, what they want to do is metaphorically swim even harder. So maybe that means taking on more obligations, pushing themselves when pacing might be a little bit more helpful to them. Showing up to all the events instead of choosing certain events given their status at that time and their capabilities at that time. And that's really trying to get away from the distress of and the loss and maybe the sadness of, these are the symptoms that I'm feeling right now, and making a decision that's going to help their overall health and effectiveness in that moment. So when we can notice that we're doing that, how we respond to the wave, and just knowing how we typically want to respond, what that urge is, then we can have the insight to respond to it in a way that's going to be more healthy and effective to us over time. Some other ways that I've seen people try to cope with those waves, maybe ineffectively with POTS, is trying to swim faster, but also trying to just kind of check out. It's really tempting to want to just remove ourselves from the relentlessness of having to manage symptoms. And that's completely understandable. And yet sometimes then we can get blindsided or disconnected from our values, or running in such a way that we're not making mindful decisions about even just bringing those very practical tools with us, because we're just trying to keep moving from one thing to the next. So both being able to know how you might typically respond to an overwhelming wave, being able to handle it and let it live its life, knowing that those emotions aren't going to hurt you. And in fact, by being able to experience them, sit with them, and accept them, they can run their course, and then we can make those effective decisions with mindful intention. And with that, that will move us oftentimes towards our values and our goals overall. There's a lot of metaphors that also feed into this too, like being able to ask for support, being able to ask for like the lifeguard to come out, whether that be a family member, a trusted member of your friendship group or chosen family, but being able to learn how to manage those ebbs and flows. And I think the biggest thing that I see with patients is just knowing that it will not always feel this way, that it will change, that when we are feeling overwhelmed by those emotions are not the most reliable reporters of what our life is always going to look like, and that this distress is momentary and we can get through it. Especially the more that we practice swimming in those waves, we have more evidence for, I did that in the past and I can do it again. And we grow different muscles. We just grow different strengths and coping skills. So that's riding the wave. And if you're a visual person like me, it can be a really helpful thing to notice. And then the last one that we're going to cover today is catch it, check it, change it. So if riding the wave is kind of finding that context, and being able to put yourself in a place of understanding that what I'm feeling right now is not all that there is, and that I have coping skills and ability around that. Catch it, check it, change it is kind of zooming in, and it's focusing on the thoughts that come up in our lives. This is a core skill in cognitive behavioral therapy, which is another modality that we use at Evolvinn, and is really an evidence-based therapy for many sort of health conditions that can be helpful. Because what it does is it looks at our thoughts and how our thoughts impact our emotions and our behaviors, and vice versa, all the way around. So when we have thoughts, we have them all the time, but they're oftentimes not necessarily as conscious or in our control without looking at them as we might initially think they are. And our bodies and our minds are hardwired to help us survive. And especially when we're navigating invisible conditions, conditions where there might have been dismissal, there are experiences of trauma, maybe medical trauma, or just scary symptoms that feel out of our control. Those experiences really shape and impact our thoughts. Our minds are hardwired to look at what's going to keep us safe, what's going to help us manage getting through our days day by day. And so oftentimes our thoughts can become sometimes a little bit, oftentimes very risk averse, fear averse, or influenced by these hard things that we experience in our life. Conversely, they can also be influenced by really joyful, positive learning experiences as well. But oftentimes what we see with patients is that these beliefs over time have been shaped and formed by these experiences that are difficult. So, certain things that I will hear oftentimes in session with people that I work with is, I don't have the life I used to have. My life doesn't mean as much as it used to. Or I'm not living the life that my peers are living. I'm never going to get that promotion at work, or I'm not fulfilling a role that's really important to me. I'm not a good mother. I'm not a good father. I'm somehow not achieving as a student. And those might be those core beliefs that we're not even necessarily aware of that are running in the back of our mind. And those can prompt something called automatic thoughts, which are these beliefs that come up and influence our day without us even realizing it. So maybe you get invited out to get a coffee from a friend, and you'd love to see this friend, but you think, oh, it's just too hot out. I can't ever do that. So then that automatic thought will then influence our behavior to say something like, I'm not able to do that anymore. And then that would potentially influence our emotions of feeling sadness, isolation, or loneliness. So very quickly, we can see how our thoughts impact our emotions and our behaviors. And like Dr. Maglio was saying, having that I love the word that you used, was curating a positive mindset takes work, and catch it, check it, change it can be a way of doing that. So the first step of catch it, check it, change it is catching it. And it's noticing what are those thought patterns that are coming up for me most frequently. What's really driving my behavior? And I will say, by the way, that this is often very hard to do individually. So doing it with trusted people in your life, or a therapist, or on your own through journaling can be a really positive way of just starting to notice what are those thoughts that are coming up most frequently for me. And then once we have that thought, kind of catching it throughout the day. I think about it as Pokemon Go, which might show my own nerdiness, but kind of trying to catch those thoughts that come up, that are popping up throughout the day, and trying to be proactive in seeing, oh, am I really believing that I am not a good daughter, that I'm not fulfilling my professional obligations? And once I have that thought, and I can often notice whatever it is, if it's strong emotions or strong behaviors tied to it too, or something that feels cyclical that I might feel stuck in. Once I've caught it, I get to check it out. Is this true? Is this helpful to me? Is it effective in my life? Is it in line with my values? And evaluating with really hard evidence that you would only take before like a court of law, not your emotions, but evaluating the evidence for and against that thought of, you know what, I got a really good review at work. Maybe I am fulfilling obligations. Or with that friend that's inviting me for coffee, you know what, it might be hot, but I think that I could go somewhere where it might be cooler or air conditioned. So really checking out those thoughts with evidence and then changing it. If that thought's not going to hold up in a court of law, or it's not effective or helpful for you, how can we make it more helpful or effective for you? So yes, my role has changed as a mother, but I'm able to show up for my kids in new ways because I'm home more often. Or I'm thinking about specific examples of things that we've worked with through people, and just being able to say like, okay, even though and by the way, when we're doing change it, we're not getting rid of reality. We need it to be effective. We need it to be something that is actually true to that person. We're not trying to silver lining anything, but what we're trying to do is broaden the scope of all the potential evidence and then narrow in on what's going to be effective for us moving forward. And oftentimes that does actually take a both and of, yes, this has happened and this is still true too. So catch it, check it, change it has a catchy title as well, so it can be easier to remember. But it can be a huge cornerstone in starting to see those patterns that have maybe emerged over time, and for thoughts that have become more entrenched. So as we all have said, these are different skills that are going to be effective at different times. There's also acknowledgement that part of what we're not talking about as much today is just the processing of maybe the loss and grief that go alongside those proactive steps that we're taking too. And actually by processing all of those emotions and making room for all of them, we can live a more effective life, and a life that is in line with our values, that is meaningful, even as these challenges continue to arise and shift and change over time. And those tools can get stronger so that you can use them in different ways as POTS continues to look like it's going to in your life. So with that, hopefully there are some really positive or just helpful things, that tips and tricks that can be more effective in someone's life. And like I said, also, it can be very helpful to have trusted people around you, journaling, having some objectivity in something that feels extremely overwhelming and subjective sometimes too. So yeah, thank you so much, Dr. Lewis, for letting us talk about all of these different aspects.
Thank you, Dr. Penn. It really strikes me as y'all are talking that, for many people who develop POTS, it's happening during adolescence. It's happening during these real milestone times in their lives, high school, college, first job, first relationship. And so while that's hard enough in someone who has perfect physical and mental health, it's really challenging because you're still just forming that identity and you're forming your relationships with people, and to ask for support from people when you're still like forming those relationships, that's really hard. And to reflect on yourself when you're still figuring out your own identity, it's so challenging, isn't it? On the other hand, to look at the sort of the brighter side, if we use your strategy, I think using strategies like this as people develop their identity can help you develop into a really strong, self-reflective, compassionate, self-compassionate person, can't it?
Absolutely. And, these tools are tools that are helpful for every individual.
Right.
And I think so often for people that I work with, they are choosing, and because they're being proactive, they're choosing to step into the hardship of it. And I see that as an extremely brave act. But it's something that, whether it's in POTS or whether it's in relationship or it's identity or different developmental stages in life, these are actions and tools that can be fostering of self and identity at any stage, but might be more needed and more supportive. To your point too, the strength that I see in so many people who step into this, there's a maturity there and a self-knowledge that's hard fought for often, but also is extremely notable. And difficult. It's the both and at the same time.
Right. I think a lot of people look at their peers and feel like they're so much older and wiser than their peers because they've been through so much that most 20-year-old, 25-year-olds have not been through.
Absolutely. And responsibility. There
Yeah.
is a tremendous amount of management that goes into POTS and chronic health conditions that many people, when they're in college, might not have to be thinking through what they're eating, how they're moving, how they're navigating the world, class load in the same way as well. So there is a burden. There's an actual burden of task and responsibility. And it's a lot. And so I have so much respect and also care for people who are navigating this. And I don't know, it's like you're not alone in that. And so I think sometimes it can feel so isolating as well.
Yes. In fact, actually, I would open it to any of you to maybe speak to the power of support groups and peer support groups, because I know that one-on-one, you all can do a lot of incredible strategizing with people, but what do they get from speaking with their peers?
There's so much that happens in the group that could not be created in an individual session. And I think it's so powerful. What I found in the groups is that, first of all, many individuals have never met or interacted with someone else who has POTS. So all their experiences are so internal to them. And it is like this massive weight and relief that they feel when they hear even just one other person, let alone 8 other people with a similar story. It is unbelievable to see the transformation, the connection. There's often just significant isolation that comes with, having POTS and managing it. And to put, 1, 2, 5 people in one room together has just been truly a remarkable experience. I think the validation piece happens so naturally in a group setting that is just incredibly powerful. The connection, the support, I know you were going to see that doctor last week. How did it go? Can we plan for that interview that you're going to have in 2 weeks? How you're going to survive that outdoor event that you have to go to this weekend. People really bring their biggest challenges to the table. And I think the solutions, the tips, the tricks are helpful, but even more compelling and powerful than that is just the support of like, wow, there's other people who get it and, truly are on a similar journey and adventure with me, alongside me. And it's truly been a game changer in many people's worlds to be able to, no longer have the sense of isolation and be able to support one another both inside and outside the group setting.
And do you find that people that seek support either on the Facebook POTS page or Dysautonomia International, some of the more anonymous, huger platforms, do you find that helpful or harmful?
I think it depends what the tone is. I think there's some group environments or settings that promote, a lot of negativity and just kind of venting about what the condition has done to people's lives, which certainly there's an appropriate place for that sense of grief and loss that's impacted people. But I think being able to kind of challenge each other and work towards improving quality of life is just really valuable. And I think it has to be the right setting and situation to really promote that type of thinking and encouragement, because it's easy to kind of sit in all the negatives that come with this, the trauma, the grief, the loss, that I used to be able to do this and participate on that team and I'm no longer able to do that, or kind of your life pre and post for some people. It's really easy to kind of sit in that negativity, but that's not always the most helpful place to be for people. So, being able to acknowledge that and give space and emotions for that piece of things, and also at the same time, talking about, improving quality of life, living a life more in line with values, with supports in place, improving, symptoms and strategies in their life, relationships. I think there's just so much benefit to that. So it really, I think, takes a certain type of context, and I'm thorough in terms of my selection of who's involved in each group to make sure that we're all talking the same language and on the same page in terms of promoting that positive, not even positivity, but just quality of life improvements and kind of working towards bigger goals together.
Yeah, no, I've certainly seen patients come in for their first appointment, having gone on the internet and really terrified. I saw a 70-year-old person with POTS who hasn't been out of her house in 30 years, that kind of story that tends to get blown out of context. Okay, good. So, but in the right context, I think it is nice to have that support, but I see the value of an actual curated kind of support group. Dr. Patton, were you going to add something there?
Just adds to expectation setting as well, and kind of a little bit of maybe like sample bias. I think that we can find a lot of examples of the symptoms that are so problematic, the hardship of it, because oftentimes people are turning to these platforms in order to find some sort of help or hope in a sea of possibilities and navigation. And it is so powerful to have examples of people living their lives fully. And I think that's what you do get in a support group, is that more intimate knowledge of the successes. And so I think that that's something I've seen as well. Just that expectation setting can be so helpful for keeping the options open.
Yes, thank you. All right, there's a question in the chat. Do you find therapy alone or therapy plus medications the best way to manage POTS? And I'll let any of you answer that. And maybe I'll start with a quick, from a medical standpoint. I think managing the medical piece of POTS is crucial before you manage anything, because if you haven't got your salt, your compression, your exercise, and if needed, Midodrine, Florinef, whatever else, it's really hard to not feel exhausted and not feel anxious and not feel all the things that happen physically because of these physical symptoms that leads to all these others. But I think the question is probably asking more about therapy and medication for depression, anxiety. So maybe you all want to add about that.
I would say from my perspective, it really depends on the individual and what they're going through. I think it's kind of on a case by case basis. I think there absolutely can be a role for more psychiatric medications to help improve sometimes even physical symptoms, and also mental health challenges that are someone is experiencing. But I think it really depends on the individual level of symptoms, impact on functioning, to kind of determine whether medication would be helpful or not. Sometimes I've actually seen some success in medication being started, therapy being implemented, being able to make a lot of behavioral and psychosocial changes in someone's life, and then being able to taper off the medication, because they've been able to access all the coping skills and resources. But I think it really depends on the severity of the symptoms and the impact on functioning, whether or not medication is warranted.
Does it impact your decision if somebody had pre-existing depression or anxiety before they developed POTS?
I see us all nodding, but I think absolutely, yeah. Yeah, just because it has potentially other factors that are contributing to that depression, that longstanding mood or anxiety symptoms, where we can see POTS then exacerbate or make worse some of those symptoms and that interplay. But as Dr. Dos Santos was saying, it's so case by case. But I do think that having a history of struggling with specific anxieties or depression really does speak to the ways that managing it might look differently as well, and maybe not be so episodic, but more longer term ideas as well that we would implement.
Yeah, I think that's really smart. I think, just physically, the adrenaline, norepinephrine levels that are so high in people with POTS can contribute to that feeling of jitteriness, headaches, fatigue, that it's very hard sometimes to sort it out, isn't it? Because one plays into the other. All right, I've got one more. So go ahead.
I was just going to say, I think it's really valuable, from our perspective, to collaborate with the medical providers involved, because we're often seeing patients on a weekly basis, sometimes more often, sometimes every other week, but really having a lot of data points and reference for what the symptoms are, what they're experiencing. And so, I really try to open the lines of communication with the other providers that are involved to be able to have those conversations behind the scenes with the patient's permission, to be able to kind of share, what we're observing and kind of talk through maybe some options that could be beneficial.
Perfect.
Yeah.
All right. I think we have time for one more question. Again, I'll open this to all of you. When I go through flare-ups, I can't help but feel distant and unreliable with friends, family, work, and school. I don't want to stop making plans and commitments, but I also hate having to cancel all the time. How would you communicate and navigate it?
This one is so tricky, and I think, it does in ways depend on the person, and depends on, who in your in your social network or at work understands what you're going through and to what degree. But I think sometimes a helpful strategy could be thinking about, setting those realistic goals, right? So if you want to see friends, but maybe it doesn't feel like it's best to go out and spend several hours, out somewhere. Are there other ways that you could see your friends, whether it's inviting them over, maybe watching a movie, doing something that feels like it's within and more manageable and within reason, depending on how you're feeling? And then I think too, also taking advantage of the better days. If you find that you're having a better day, what can you do at that time? Are there friends you want to reach out to? Is there something else you could do with family or work? I know that's a really quick answer because I know we're running a little bit short on time, but I think setting those, realistic goals for how you're feeling in the moment, and knowing it's okay if you need to adjust them depending on how you're feeling. So I guess also goes back into that self-compassion piece too.
Yes, so that I think it's really hard, again, as you said, depending on who it is. Are you just completely open and say, listen, I've got POTS and I can't always say that 3 days from now I'm going to feel great, but maybe finding those people who are okay with hey, I'm having a good day. Do you want to go out for something, a walk? And biting off, lowering expectations, biting off small tasks that feel accomplishable to you, so you don't constantly set yourself up and over expect, then set yourself up for disappointment and your friends too. So that's really hard. Yeah, I bet we could go on that one for a little bit longer. But I love your short answer. All right, but I will, respectful of everyone's time, I first want to thank our audience for showing up and asking such good questions. And I really want to thank the three of you. My goodness, so, those were 6 hacks, but in those 6 hacks, we really covered a lot of ground about sort of setting realistic expectations, using your perspective to zoom out and zoom in, and the bite-sized cognitive behavioral therapy and the dialectical therapy, and all these ways that we have tools in our toolkit to sort of reframe the narrative. And instead of focusing on all the things that POTS takes away from us, what else is left behind and who is down there behind, and what strengths do you still have that you can use those tools to sort of create the life that you want to create. So I want to thank you all for joining us, and we'll put everyone who attended will get an email with a questionnaire. So I hope you'll answer that, and also with contact information for these 3 doctors who will have information on how to reach them and their support groups and their individual therapy. So thank you, everyone. Have a wonderful day. Stay cool. It's very hot here, probably where you are too.